Diabetes, or high blood sugar, was rare in sub-Saharan Africa 30 years ago. But today, 20 million adults on the continent are living with the disease. By 2040, this number is estimated to rise to nearly 50 million people, the highest increase anywhere in the world. In sub-Saharan Africa, almost 400,000 people die every year from the complications of diabetes, and 3 out of 4 of these are under the age of 60 years. In Africa, diabetes affects adults at a younger age and people who are leaner than is the case in high-income countries. One challenge of diabetes is that it affects many organs in the body, including the eyes, kidneys, and the heart. It damages nerves, particularly in the legs and feet, which can be painful and disabling. Through its debilitating effects, it causes poverty in families and societies. Diabetes requires lifelong treatment and monitoring. It is a disease that incurs high expenditure by health services everywhere in the world, but particularly so in sub-Saharan Africa, where there is a very severe shortage of healthcare workers. Having diabetes incurs high costs for patients who have to miss work and travel to health facilities regularly for care. Because of these factors, the control of diabetes in Africa is very poor. Less than 10% of people estimated to be living with diabetes are in regular care, and even among these, only about a third are able to control their blood sugar adequately. Preventing diabetes is a priority, but to date, there has been limited research conducted in sub-Saharan Africa. We know from research done in high-income countries that there are 2 main ways of preventing diabetes: either by people changing their diet and lifestyle behavior, or by taking drugs that lower the blood sugar levels. Data from sub-Saharan Africa are lacking, but available interventions to support people to modify their diet and lifestyle are resource and time intensive and would not be practical in most settings on the continent. We are the Research Partnership for the Control of Chronic Diseases in Africa, or the Respond Africa Group. We are evaluating whether Metformin, an old drug that has been commonly used to treat people with diabetes since the 1950s, can now be used to prevent progression to diabetes when given to people who are at high risk. We want to know whether Metformin can prevent or delay the time to development of diabetes. Our high-risk population are people living with HIV whose blood sugar is raised but has not reached the threshold for a diagnosis of diabetes, also known as pre-diabetes. The evaluation is being conducted using a Phase 3 randomized placebo-controlled trial in Dar es Salaam, Tanzania. This is the gold standard design for evaluating biomedical approaches. Over 2,000 people with HIV and pre-diabetes will be invited to join the research study. This group of people have an annual incidence of diabetes of about 10%. Half of the participants will receive the Metformin and half will receive a matching placebo. Neither the participants or the doctors doing the evaluations will know which is the active and which is the inactive drug. The participants will be in the trial for 3 years to enable a long-term assessment. Over this time, researchers will measure how many participants develop diabetes in the 2 trial arms to see whether or not Metformin is effective in preventing diabetes. This will be one of the largest trials ever conducted in diabetes prevention in sub-Saharan Africa. It has been designed in a partnership between researchers, patient leaders, healthcare providers, and policymakers, and its progress will be monitored regularly by these stakeholders. The results are intended to inform health policy and clinical practice across sub-Saharan Africa. Alongside the trial, we are using the opportunity to enhance research capacity in clinical studies of diabetes and investing in the next generation of African researchers.